You may have heard public health authorities or other peer institutions talking about the concept of universal masking, or wearing surgical or procedural masks in all healthcare settings. While this is not standard infection prevention guidance, these are extraordinary circumstances, and we have increased viral transmission in our communities. Beginning on April 3rd, 2020, all Johns Hopkins Medicine employees will now be required to wear a surgical or procedural or cloth mask in all clinical healthcare settings. We believe that this new policy change will help our employees feel more comfortable and prevent viral transmission from asymptomatic individuals or mildly symptomatic individuals who may be carrying the virus that causes COVID-19. While we utilize this approach of universal masking, it is important that we remember a number of very important things. First, we have to continue to utilize our personal protective equipment supplies in a very wise and appropriate way. And that means adhering to the instructions for reusing masks and storing them properly. Second, we need to have strict adherence to hand hygiene and social distancing. Both of these are fundamental to preventing transmission of the virus. And we need to guard against the idea that wearing a mask is a protection for ourselves from acquiring the infection. In contrast, remaining 6 feet away from others in our immediate area and washing our hands frequently are the very best ways to prevent acquiring the infection. Next, it is very important to wear the mask properly, covering your nose and mouth, and refrain from wearing it in other ways, such as on the top of your head, on your chin, or hanging around your neck or your arm. And while you are wearing the mask, refrain from manipulating and touching it, as the outer surface can become contaminated, and touching your face inadvertently can lead to self-contamination. Any type of respirator must still only be worn in specific high-risk settings or procedures. This includes the use of N95 or Draeger respirators or PAPRs. Johns Hopkins Medicine employees can obtain a surgical or procedural mask to wear in the healthcare clinical setting from their supervisor, work area, or departmental or entity incident command. Please remember, when putting on or removing your mask, that you must do hand hygiene before and after this task to avoid self-contamination. Finally, if you have any additional questions about this or other topics, please see our internal resources portal. And thank you again for all you do to protect our patients, yourselves, and your colleagues.